Hi everyone, my name is Razia and I am doing a session today on ectopic pregnancy. I can do any topic if you like. Just leave in a comment. From there, I can take up and see how I can present it to you in an easier way. So, my aim is to cram the stuff. Today, I am hunting on ectopic pregnancy. I believe it is a great topic to start with, especially because this is asked a lot and we see this a lot of times, at lot of lot of times, I guess. So, firstly, what is ectopic pregnancy? At around day 5, following the conception, people can have anyone any person, sorry, can have implantation, right? So it's around day 5. So when there is implantation happening, it is very important period of gestation. If it is on the fundus, it is intrauterine pregnancy that can be managed just like any other pregnancy. Whereas if it is ectopic, meaning the implantation can happen anywhere across in the ovaries, in the fallopian tubes, and it is a complicated pregnancy indeed. It may rupture and may cause bleeding and so on. So most of the times we want to remember the symptoms. They will present with abdominal pain. Abdominal pain is a big one. And they will present with vaginal bleeding. Apart from this, they may also throw up pelvic inflammatory disease in the question. So make sure you look at it. If there is recurrent pelvic inflammatory disease, ectopic pregnancy is one of the complications if left untreated. Now, what happens? What is the next best step that you may want to do? Of course, it is beta HCG. In the beta HCG, you will confirm it. The patient is pregnant or not. Following which you have to do ultrasound. Here in US, most likely preferred is the transvaginal ultrasound because we can detect the fetal position and with respect to the uterine rotations, position, and so on. If the patient walks in with hemodynamic stability, meaning absolutely fine, but you have a suspicion, we have to do transvaginal ultrasound. Okay. Now, if the patient is unstable, bleeding profusely, and there is rupture, we will go with the laparoscopic surgery immediately. No matter what we have to do, because this here the question of maternal life is coming into play. And so we need to address this immediately. In the TV US, that is in the transvaginal ultrasound, we will see the uterus. We will see the fetal position. If it's intrauterine, you can go with just like any other pregnancy. However, we are not talking about this. Our main focus is on the ectopic pregnancy. For that, we need to focus on the beta HCG. This is the utmost of importance. It is a beta HCG. So, anytime beta HCG is pumping up, okay, that is a high concern. We never want it to pump up. And so we are going to monitor for the next 2 days. If it is decreasing, that means it's a good news. We want to keep monitoring until it goes down. However, on the other side, if it is increasing, okay, if it is increasing, you may again want to do transvaginal ultrasound and keep monitoring the beta HCG levels. Now, how do we treat ectopic pregnancy? If the patient is stable, we give methotrexate. And if the patient is unstable, you have to prepare her for surgery, doing the PT, PGT, INR, blood grouping, cross matching, consult OBGYN, and finally do the laparoscopy. So, this is it about ectopic pregnancy. Let me know in the comments if you would like any other topics we can discuss in detail and I can present to you in a much better way. Hopefully, the study sessions are useful to you. Thank you.